Hello, everybody. Thank you for all joining in for today's session on fragility and fractures. Today we have our honorable guest, our Dr. Hitendra K. Doshi with us. He will be discussing to you all how we can prevent our bone health, right, Dr. Doshi? And
Yes.
to avoid these fractures, his motto is prevention is better than cure, which we all believe in. So with this, I will hand it over to Dr. Doshi to present. Dr. Doshi, the floor is yours.
Thank you, Minu, and very good afternoon to one and all. I think, first of all, I want to thank Minu for creating this platform to really share a lot of awareness, especially when it comes to bone and joint health. So, allow me to introduce myself once again. I'm Dr. Hitendra K. Doshi. I'm an orthopedic specialist. I practice in Gleneagles and also in Parkway East Medical Center. And what we like to do today is I'd like to share with all of you a topic which is very close to my heart, and it's pertaining what we call orthogeriatrics, which simply means bone and joint problems in the elderly. Now, as we all know, the aging population is on the rise, and whether we like it or not, someday we are all going to age. So I think it's very important to understand these aspects, especially the issues of concern in elderly who has some degree of osteoporosis, and many of them, while they lead an active life, they do succumb to injuries. And one of the greatest concerns is after a fall, many of them develop a fragility fracture, and especially when it involves the lower limbs and the hips in particular, it can impact their life very significantly. So, as it is important to create awareness of fall prevention in the elderly and also uh, try to screen for osteoporosis and treat them, it's also important for many of us who are in the middle age group or even in our younger years as a teenager to look for this aspect very critically so that we ensure that we do not end up having a problem of low vitamin D, osteopenia, osteoporosis, because all these preventive aspects must start from a much younger age. So allow me to now share my slides, and Minu, we will start off. Is that all right?
Yes, yes, absolutely. You can share.
Okay. Is it
You can
visible to
increase.
everyone? Minu, good.
Yeah. Yes, yes, yes.
All
Perfect.
right. So we'll start off with the presentation for this evening. Now, as you can see here, the demographics of the elderly population is certainly on the rise. And you can see it's not a problem just in Asia, it's throughout the world. And this is a good thing, but nevertheless, we should be sensitive to the issues of concern. And that is why, in current times, there is a repeated and a constant call to all medical professionals to do more for the aging population, may it be due to osteoporosis or treatment of multiple comorbidities, from the aspect of physiotherapy, and also from the advancements in the kind of surgery we do for the elderly population. Now, if you look at just the incidence of fragility fractures, just talking about hip fractures alone, we can see that the numbers are rising incrementally, and it's happening throughout the world. Now, these are just some statistics from the European countries where you can see a distribution of how a fracture at different aspects of the body, and you can see that the fractures involving the proximal femur, that means the upper part of the thigh bone near the hip, remains to be the most common fracture affecting the elderly. Now, the local scenario is no different because uh, I myself, coming from my former hospital in Tan Tock Seng, we used to see almost 3 to 4 hip fractures every day. We're talking about just one hospital in Singapore. So if you were to collate all hospitals together, you can imagine the number of people who end up with a hip fracture. Now, if you just look at upper limb fractures, which are what we call proximal humerus fractures involving the shoulder. There has been an incremental rise over the years. The same thing with the proximal femur fractures, there's an incremental rise. So this is certainly an issue of concern, and that is why we are all here today to try to understand the problem better so that number one, we can avoid the issue. And number two, it's also important to know if an individual succumbs to such a problem, what more should be done and how should we manage this problem so that we bring the elderly back to his or her pre-morbid state, which means that we want to let them continue life in an active way so that they can still enjoy and age gracefully. Now, let me just go through some examples of my patients over the years. This is 82-year-old individual who is shopping, which is a sign of uh, uh, an elderly being very active and very healthy, and that's what we want. But unfortunately, she fell over something and she tripped and fell, and she succumbed to a very bad distal humerus fracture. So this is around the elbow, where a very bad fracture. So she had to undergo a surgery to reconstruct the bone so that she gets back her function. And you can see at 2 weeks, she's again smiling. She's happy because she's got her mobility back. Another example of a female who's living alone, and many of us these days, especially elderly folks who do live alone, they need a great degree of functional independence. And she was just changing her tube light, and again she missed the step, and she fell and she broke her elbow. And again, she required a surgery to restore function and mobility. And here you can see again, after the surgery, she's able to hold her back and she's again functionally dependent. But it is very important to avoid falls, but sometimes it does happen due to unforeseen circumstances. But on the other hand, if your bone is very brittle and it's having significant osteopenia or osteoporosis, then that particular individual is going to be more vulnerable to getting a fracture. So that is what we are all here for today, to understand the problem and to see how we can mitigate to our level best these issues of concern. Now, many elderly today are riding motorbikes, they're going around on a cycle. And I think this is not something we just see in Singapore, but even in India and in our other neighboring countries, we see this as a common trend. Many elderly are also gainfully employed, and to commute, they need to take public transport, and some of them even cycle to work. So there is another issue here now that if an individual, gets involved in an accident, then it's called a polytrauma. And this is another classic example of a patient which I had who was involved in an accident, but he being elderly, there are other issues of concern because many elderly people may have some degree of compromise with regards to their chest function, their heart function, they may have diabetes, hypertension. So they become more complex in trying to manage a problem, especially when they have a fracture. So this particular individual had an open fracture of the tibia, his femur was also shattered in multiple parts, and he also had an upper limb fracture. So he had to go through multiple surgeries, and it was very challenging, but thankfully he did well. And of course, with current day and time, we do it in a very minimally invasive approach where we make smaller scars and we use better locking implants to restore a good anatomy and help them regain their function. So it's very important to understand an elderly because on one hand, you have got a lot of issues with the bones because of osteoporosis and osteopenia. On the other hand, they are also very complex because they have multiple medical issues such as diabetes, they may be having heart failure, and many more. Now, an elderly may also have impaired reflexes, and that's why sometimes they're more prone to get an accident. For example, the ability to avoid a fall, the uh, the rate of their reflex is probably a little dampened. Even their sight may not be as good. Therefore, in trying to avoid injury, it may be more challenging. Sometimes they're also a little hard of hearing, and therefore, for due to some reasons, they do not hear or are not notified in time, and then they accidentally fall and then succumb to a fracture. And of course, due to osteoporosis, just a trivial injury itself can lead on to quite a complex fracture. Now, we have multiple challenges in the past when we were trying to deal with an elderly. Number one is many of them did not have adequate prophylaxis, meaning that due to lack of awareness, many of them did not know that they were having low vitamin D, they were osteopenic, or they were having osteoporosis. Number two, in the past, the kind of implants we used to use to fix a fracture were not that ideal for brittle bones. But these days, we have got better fixation techniques and better implants. And because of these two main issues, the outcomes were not satisfactory. But today, because of advancements in technique, technology, and also we have got a better understanding of the problem and how we can manage the issues in a very holistic way, functional outcomes have improved, especially after the elderly succumbs to a fracture. Now, these are just examples of how plates and implants have become better over the years and they've become more ideal to deal with brittle bones. Sometimes we even use cement to augment our fixation because it gives better stability to the construct so that at least the individual can weight bear earlier. So after surgery, we immediately try to get them to move their arms or start walking because this is a very key aspect in ensuring that post-operative outcomes are good. Now, sometimes an individual may succumb to a fracture which is very close to a joint. And because of the complexity of the fracture and it's all fragmented, and because it is so osteopenic and brittle, it's not possible to fix it. And therefore, a doctor or an attending physician may advise that in view of the state of the fracture, the individual is better off with a replacement surgery. Meaning that if it's involving the proximal humerus, we do a shoulder replacement. If it's involving the distal humerus, then we do elbow replacement. Again, with the goal of allowing the patient to start mobility as soon as the surgery is over. Because what we are trying to aim for here is functional independence, restoring their mobility, because this is very, very important for a particular individual, especially those who depend a lot on functional independence. Now, the main issue here is the complications which can happen after a fracture. Now, for the intended purpose of discussion, I'm just going to focus on what is the most common fracture, which has a lot of issues, which is the hip fracture. So in the past, many studies have shown that once someone succumbs to a hip fracture, there are a lot of complications and the quality of life gets significantly impaired. Close to 20% may not be able to walk, they need a wheelchair, a lot of them need assistance. And this was the issues of concern in the past. And if you look at this graph, it clearly states close to 20% of them may have mortality within 1 year. Many of them get permanently disabled. They may not be able to walk after a hip fracture. But with research and a lot of investments in trying to uh, make better implants and to try and have an integrated approach of caring for someone who's got a hip fracture, meaning that it's not just the orthopedic surgeon, but you have nurse manager, you have a dedicated physiotherapist, you also get the family involved, which I'll talk about later. And when you deliver such a holistic care, functional recovery has improved tremendously and the risks of complications have also reduced. Now, one very important aspect whenever someone succumbs to a fracture, especially in elderly, is to come to a decision as soon as you can whether that individual will benefit from surgery or not. If the benefits outweigh the risk, then surgery should be done as soon as possible because any form of delay in an elderly will lead on to multiple issues such as chest infection, urine infection, bed sores, deep vein thrombosis. Many of them become delirious. Then they end up with functional decline, muscle wasting, because all of this are the precursor to a decline, and then they can succumb to things like morbidity and mortality because of secondary problems. So let's look at an example again of another patient of mine who's 76 years old, asthmatic, uh, fell in the bathroom and there's a lot of pain and she couldn't ambulate. And because of the pain and being in a recumbent position, they can't really sit up. And when you can't sit up and take deep breaths, then you have a secondary problem of pneumonia setting in the lungs. And when an individual sets into pneumonia, then this will be another problem where the person will succumb to chest infection, and many of them may end up requiring high dependency of ICU. And as you can see, the blood gases here, they've all become very bad because of a hip fracture and they're not able to breathe. So if you delay this surgery, the person is just going to deteriorate further, and it can sometimes even cost a life. This is another patient of mine who had a knee replacement, obviously because of underlying arthritis, but again, because of not taking care of the potential risk of falling, and also in view of underlying osteoporosis. After a fall, she succumbed to a hip fracture, and then she had to undergo a procedure to restore the anatomy and allow her to weight bear immediately after surgery again. So the key here is whenever there is a fracture involving the lower limb which impairs function, which causes an individual to be recumbent and not being able to sit up or even walk, then if there are no major contraindications, surgery should be done as soon as possible, not only to restore function but to avoid other complications of recumbency. So many papers, there are many research around the world, and they have suggested that just as how certain procedures need urgent attention, when elderly patient succumbs to a hip fracture, it should also be regarded as an urgent procedure because you want to limit the potential complications of delaying surgery. Now, again, here you can see in a research which has clearly proven if you delay a surgery by more than 2 days, you can see the risk of mortality and morbidity significantly increases. Hence, the driving point here is if you succumb to a fracture and if you've been advised for surgery, come to a decision early and go ahead with the surgery because the benefits will outweigh the risk. Again, another study here which shows that if you do early surgery, the risk of death, pneumonia, pressure ulcers, all become significantly lower. Again, another study here which again shows that if you delay surgery by 72 hours, there can be significant higher rate of mortality and morbidity. So then the question we have to ask ourselves is why is it that sometimes we tend to end up into a situation of surgical delay? So there are many factors for this. I think number one is being aware of the problem. So I routinely always in my practice, I would have a family conference. It's very important, not only for the elderly person who's affected to understand, but also the entire family, the caregivers to understand what are the potential risks and complications, what are the benefits. And with this understanding, then fear can be overcome and a person may consent to go through the surgery. Of course, sometimes there may be other reasons for delay. For example, if it's an open fracture or the tissues surrounding the fracture, the skin is very badly bruised, which then limits us to go through or carry out the surgery because of other concerns, then yes, there may be some delay. Of course, logistic reasons may be an issue in some parts of the world. Now, but it's always important to understand the problem, and if you identify with the benefits, then do not give too much time in trying to make a decision because time is a critical factor here. The earlier you do the surgery, the earlier you restore function, the lower the chance of you or that individual ending up with potential complications. And it is the potential complications which will lead on to deterioration, such as chest infection, urine infection, bed sores, deep vein thrombosis, etc. So the management goals basically is to fix such fractures early. And of course, at the same time, you want to correct the non-surgical problems. And you also want to prevent secondary fractures. And this becomes a very, very critical point, because when an individual first presents with a fracture, uh, it becomes a point of contact where we would screen for osteoporosis. And if they are truly osteoporotic, then it is very important to treat this problem, because many of them who get a hip fracture on the left hip, they then come back with a fracture on the right hip. So at the first point in contact, it's very important to educate and to prevent secondary fractures. Now, this is what I was talking to all of you about, that the concept of delivering care for an elderly has changed over the years, and there's been many models around the world where whenever an individual gets admitted after a fracture, it is being managed, the patient is being managed by a multidisciplinary team, which means that you have an orthopedic surgeon, you have a geriatrician to look into all other geriatric issues. You also have a dedicated physiotherapist who's just specialized in looking after elderly, in trying to understand their pre-fall state so that we can rehabilitate them back to their pre-fracture state. So this is what we call a strategy of managing such an individual, because you need everyone to look after every aspect, especially when we're dealing with the elderly person. So in Singapore itself, we have also published, and we have had the first model in Tan Tock Seng Hospital, where we had done an outcome study to show that the outcomes were very, very satisfactory. And of course, the key here again is early surgery and a multidisciplinary team approach in managing such fractures. So the technicality of surgery is just one part, but I think it's the holistic care which is very important. And on the very first day after the surgery, physio is started immediately, because we want to regain mobility to minimize or avoid all other potential complications of recumbency. Now, many people think that if you are elderly or if you're above 80 or 90, then the recovery may not be as good as someone who's below 60. But again, we have proven this to be not true, because in our cohort of patients, we were able to prove that age is not a factor in determining functional recovery. More importantly, it is to have an integrated model of care, meaning that you have a pathway for a patient to follow, where surgery is done early and rehabilitation is started early, so that all complications are avoided. And at the same time, when the physiotherapy gets on board from the start go, we find that the functional recovery are comparable, whether someone is above 80 or below 80. So whenever we see a fracture, we always tell ourselves it's just a tip of the iceberg, because there are more potential problems to it. And this becomes a first contact point to further investigate on other underlying issues like low vitamin D, the incidence of osteoporosis, the home environment, whether it's safe, right? Whether there are, concerns at home where it puts an individual at a higher risk of fall, whether they have a vision problem, whether they have a hearing problem, because you need to plug all these potential holes in order to ensure that that elderly does not succumb to a fall again, and he doesn't succumb to a bad osteoporotic fracture. So this is very important, and that is why we emphasize a lot on a holistic approach and holistic care to treat that individual. It's just not the fracture, but we have to do a lot of lateral thinking and treat them beyond the fracture itself. The secondary fracture again is very important. Therefore, many doctors today, we have an algorithm where we try to determine if this person needs specific uh, treatment for osteoporosis, and if they need, then we would refer them to an endocrinologist sometimes to make sure that they are medicated for this problem. So basically, what is osteoporosis? It just means the bone is very brittle, it's very porous, and therefore, after a trivial fall or injury, it can just shatter and that individual will succumb to a fracture. So if you look at osteoporosis alone, you can see the incidence is very, very high, right? And many of them, even after a fracture with osteoporosis, the complications can be quite high. Now, if you look into the risk factors for osteoporosis, of course, there are many, but I think Minu will later highlight again on the importance of ensuring that calcium and vitamin D levels are always kept normalized to avoid this potential problem. And of course, if you have any symptoms, then it's important to screen for osteoporosis and get it treated. So the way forward for elderly fractures, of course, is number one, to avoid fractures, avoid falls. And number two, if you or any individual happens to succumb to a fall and ends up with a fracture, then the key here is for early surgery to restore function and mobility so that you minimize all other complications. Because the quality of life after a fracture is pretty much dependent on optimizing function. And in order to do this, it has to be approached in a multidisciplinary team approach so that you can uh, fill in all the gaps and you ensure that the person or the individual goes back to the community in a very active way. And most importantly, is the person lives happily thereafter. So one of the most interesting things I've seen over the years is when my own patient, when she came for follow-up, she just thanked me and she told me that my mobility is my happiness. So we find a lot of elderly folks, they really want their functional independence. They want to be active. They want to be able to do things by themselves. And this is truly a key factor in ensuring that they are happy. Now, from the infrastructure point of view, many countries around the world are also improving on the infrastructure in the hospitals to make it more elderly friendly by creating ramps, having more bars in the ward so that it becomes more elderly friendly. And this is something that we have to understand because in every aspect of our day-to-day living, we need to integrate this to ensure that the risk of falls is minimized and you make the journey for the elderly who's active in society more comfortable. So in summary, my friends, what I would like to share with you all is genetic fractures are certainly on the rise, but they're all avoidable. Uh, the same goes with a lot of people who suffer from joint degeneration like knee arthritis. Now, though management can be challenging, but if you come to a diagnosis early and you understand the problem very holistically, then I think the outcomes can be quite uh, satisfactory. And at all times, always assess the risk and benefits very critically and do not delay in either getting yourself treated for osteoporosis or even if you succumb to a fracture uh, and if you had been advised for a surgical fixation, do not delay. Do not come to decision after 3 days or 5 days or after discussing with multiple people because this sometimes leads on to other complications and then if you succumb to other issues, then it becomes irreversible. And always uh, have the philosophy of trying to educate yourself to be more aware of things. And of course, whenever there is a need, screen for certain issues of concern like having low vitamin D or osteoporosis. And of course, at the end of the day, prevention is still the key. So with that, I thank all of you, and I hope this sharing would, ignite some amount of inspiration for all of you, immaterial of what your age is, whether you're on the extreme elderly group or even you're someone who's very young. But this is a concept, this is information that we should all understand because It may not be for us, then it may be for our elderly parents who we are looking after. And never forget, uh, you know,
Participants, yeah. Participants, please mute yourself.
also be able to plan for this is something very important. Thank you. Back to you. Can't hear you, Minu.
Thank you, Dr. Doshi, for a wonderful presentation. Let me just fix it up.
And Minu, just a last slide here that for those, if you want to have more information, you can always log on to the YouTube channel. I've shared some simple videos for better understanding of some common issues.
I'm sure they will get superly benefited by all your insights and inputs which you have shared, and you have loads to share further. Okay, so
Yes, I was talking just. Okay. Yeah.
so Dr. Doshi, I'm just stopping your share. Can you just share? Okay, fine. I will just share now. Okay, so Dr. Doshi has already told us about how we can prevent and what happens when this fractures and when gradually with time our bone health deteriorates. I would like to focus here certain conditions which actually triggers or increases the fragility of our bones over a period of time. So why I would like to focus this? Because I want you all to understand that these are some lifestyle changes which we need to understand and try emphasize and putting them in and try to do them as soon as possible so that our bone health can be really strong to avoid these fractures and post fracture conditions or osteoporosis, or later on these weak bone conditions we can avoid. So what are the conditions, what are the health conditions which actually triggers poor bone health? First and foremost, I would like to focus here on is acidity. Yes, it's very surprising. Most of the time people ask me, why acidity, ma'am? How come acidity is connected with bone health? So this is first the acidity I will discuss, and then the second is smoking, how smoking impacts on our bone health, and the third will be alcohol impact on our bone health, and the fourth we will be covering osteoporosis, how to keep our bones safe. So the first condition is acidity. See, when acidity, what is acidity? Acid generates in our stomach, which is a natural process, wherein that this acid helps to break down the food which we eat. Now, the problem occurs when this acid is generated more in our body. So hyperacidity. So when our body is generating more than what the amount of acid is needed to break down the food, this excess acid is creating an acidic environment in our body. And human body has a tendency to neutralize the internal environment. Our body does not like this extra acidic environment. To neutralize this extra acid, your body will start leaching calcium out of your bones to neutralize this extra acid. Why? Because calcium is a very good alkaline substance, easily available in our bones. Now the extremities of the bone starts leaching calcium. Thus, our calcium is compromised in our bone. So our bone mineral density starts leaching off. So bone starts becoming fragile. It is also shown that, it is also seen that people with long-term acidic condition, they often result or they often seem to suffer with poor bone health. So we need to address this acidic condition. So suppose if you are feeling acidity, first of all, you need to understand what are the condition, how you know that you are hyperacidic. If you feel continuously bloating, headache, reflux like a sour taste in your throat, or indigestion, gassiness, these can all be signs of having acidity. So first of all, you need to identify what are the food which triggers acidity in you. So I have listed here some common food which are generally the triggerers. Those who are suffering with hyperacidity condition, they should avoid this. So first and foremost are the legumes like chickpeas, kidney beans. Also those who are suffering with hyperacidic condition, they should avoid eating raw food or uncooked vegetables. Yes, eating uncooked vegetables has shown to increase acidity. So try to avoid eating uncooked vegetables. And garlic and ginger has also shown to trigger acidity. So try to avoid or reduce consumption of garlic and ginger.
Baik lagi. Try ya.
I suggest all of you to please keep yourself in mute, those who are listening, so that there is no background noise. So after garlic and ginger, also keep a check on carbonated drink like sodas, colas. Those should be less. And especially drinks like sugary drinks should be reduced, because yes, sugar or sugary drinks or sugar-rich food increase acidity. Also refined flour or processed food, which are very acid prone. Try to cut down these foods in your daily diet. And also sometimes it is seen that caffeine intake, like in terms of tea or coffee, has also shown to trigger acidity. But sometimes the reverse effect also is seen, like because of excessive acidic trigger, if you see some migraine, then caffeine intake helps as well. But in general, try to reduce the amount of coffee or tea. This will help you reducing acidity. And with this, try to increase your water intake. Try to drink plenty of water so that you are not dehydrated. And remember, water helps flushing out of extra acid which is generated in the body. So the few changes which I want to suggest is to prevent acidity or to reduce acidic condition is try to eat healthy, wholesome food. Change your eating pattern. Now, when I say eating pattern, it means try to chew your food slowly. Try to have small bites at a time and try to chew thoroughly till the point you see zero solid food is left in your mouth to chew further. Remember, this is very crucial. Most of the time we don't focus on how we chew. We usually chew 3, 4 or maximum 5 times, and by the time the food is inside and next bite is already inside our mouth. This is absolutely not correct, because we must allow food to be there in our mouth for the salivary juices to break down and work on it nicely. If we don't chew properly, that unbroken, unchewed food is passed into stomach, and we all know stomach generates acid to break down this food. If more unbroken food is there in your stomach, it will call for more acid, and thus it will enhance your acidic environment. So try to eat slowly, chew thoroughly. And try also to eat till you're almost full, but not 100% full, which means try to keep small space in your stomach and wait for 10-15 minutes after you are done with the food. Trust, you will not feel hungry. This 10-15 minutes gap will allow you to feel full. Also, try avoiding sleeping or lying down after having a full meal. Reduce your alcohol intake. Try to quit smoking. Avoid tea, coffee intake of too much. And those who are suffering with hyperacidity, try not to sleep directly lying straight. Try to lift your head little up so that reflux will not go in. So avoiding these things will help you. But remember, exercise. Exercise is very crucial to improve acidity condition. Why I'm focusing on this acidity? Because acidity is directly related to poor bone health. So after acidity, I would like to focus here for smokers, those who smokes. What happens to them? Most of the time I discuss with my clients. They say, how does it matter, ma'am? We know heart health is impacted, lung health is impacted. How does bone health is compromised with smoking? So now for you guys, those who are smokers, they need to understand, when you smoke, It reduces the blood supply to the bones and to other different tissues of the body. The nicotine in the smoke, in the cigarette when you smoke, it slows down the production of osteoblast cells. These are the bone producing cells. So production of our osteoblast cells goes down because of this nicotine. So now you can understand, for the moment you smoke, for smokers, regular smoking reduces production of your bone cells. Not only this, smoking also decreases body's absorption of calcium. We all know how important calcium is for our bone health and other vital cellular function of our body too. So smoking, yes, remember, this reduces the absorption of calcium in your body. Even though your diet is rich in calcium, your body will not be able to absorb the amount which is needed. And also, if you're a smoker, smoking makes you prone to osteoporosis and bone fractures. Why? Because, of course, if the minerals are not absorbed properly, which are needed to improve the bone mineral density, and we all know bone cells, uh, which uh, which becomes old, and we need continuous production of new bone cells, which are possible by these osteoblasts. If nicotine is there, that reduces, that slows down the production of these new bone cells. So definitely this will become, your body will become prone to having weaker bone, poor bone health, and that will of course trigger more fractures, and healing of the injuries will also get delayed. So try to quit smoking. Remember, I'm sharing data here. This nicely says what all smoking actually impacts. When a person smokes, it impedes the hormone called calcitonin, which builds our bone. Calcitonin is responsible in our bone building. Now, smoking is hampering. Now, smoking increases our corticosteroid hormone cortisol, which is a stress hormone, and that also increase bone breakdown. So we are indirectly breaking our bone by increasing smoking or continuing smoking. Not only this, smoking damages our blood vessels, and this also interrupts in the supply of blood to the bones. So we must understand how crucial is for us to improve our bone health. We must stop smoking. And also remember, nicotine and free radicals, which are generated in our body day to day, kills our osteoblast cells, which helps making in our bones. So ensure that you stop smoking or quit smoking. It's just a matter of discipline. Few days, try hard, say no to it, and it is doable. And after smoking, I would like to focus here on alcohol and its impact on our bone. Yes, high cortisol levels are seen in people with alcoholism. Those who are regular alcohol users, you become alcoholic, and alcoholism has shown a direct increase in your cortisol levels. So this increased cortisol level can decrease bone formation, and also since the bone formation will be low, poor bone health is there, so this will increase your bone breakdown. And as I have suggested, increased bone breakdown, decreased healing of this bone. So remember, chronic alcohol consumption also increases parathyroid hormone in our body, which also helps in leaching out calcium from our bone. So we all understand now that yes, how important is to maintain bone health for good lifespan in later ages. So try to improve your lifestyle by saying no, cutting down these elements which are deteriorating your bone health. So remember, excess alcohol kills osteoblasts, the bone making cells. So it is not that difficult to say no, or at least cutting down on the number of glasses you drink. Each glass matters. And now I would like to focus on osteoporosis, which is a common condition both in men and women, but women are more prone to, because this is a condition which gets triggered post menopause. And I would like to focus one more condition here, post-menopause, the first 5 to 6 years are crucial towards women bone health. Women bone health, bone loss is maximum towards this first 5 years of menopause. So this is the time you must take special care of your bone health, of your diet, your exercise, and overall lifestyle. And this is one of the crucial time in a woman's life also, where a lot of anxiety issues are there because of changing health condition. Things are not no more the normal with you. We all understand, but yes, we cannot ignore our bone. Remember, this is the a crucial time you must check, or you should always keep checking on a regular basis your vitamin D level, calcium level. But onset of menopause and the next 6 years, you should be very, very careful and watchful of your diet, your calcium levels, your vitamin D levels, your protein levels. Not only that, I will discuss uh, what all ingredients which we need. See, calcium is foremost, vitamin D, phosphorus, magnesium, and vitamin K. These are the bone healthy nutrients which one need to have. And remember, protein comes along with everything. For formation of any tissues or any bone or any cells, we need protein. So do not ignore that. And what are the sources of these elements, these minerals and vitamins in your diet? I have listed those two. Milk and milk products, say it is milk, yogurt, cheese, paneer or cottage cheese, whichever form of dairy, soya bean or soya product like tofu, tahu, tempeh, soya milk. These are also excellent source. Sesame seeds are very rich source of calcium in our diet and easily absorbable source too. Fish, salmon or any sea food, these are also rich sources for your calcium and bone healthy diet. Green leafy vegetables, I have written here spinach, but spinach is not the only source. All leafy green vegetables helps towards it. Add plenty of mushrooms in your diet. Yes, vitamin D is very rare, very rarely seen in any food unless and until it is fortified with vitamin D. Sunshine is the only source we say for our skin to develop vitamin D. But some ethnicity are not capable, people of certain ethnicity are not capable of converting vitamin D correctly, and we Indians or Asians fall in that category. So for us, sunshine exposure is very important. I usually advise try to expose yourself to early morning 2 hours sunlight. Not only that, in spite of having that sunlight, it is seen the levels are usually found to be low. So supplementing yourself with a regular vitamin D supply is a good idea. But mushrooms, recent study has shown that button mushrooms have shown to have 7 IU per 100 gram of mushrooms, which is also very, very low supply of vitamin D, but there is no harm in adding that. Mushroom adds on to other factors which contributes towards bone health. So try to ensure your diet is, you are also adding mushrooms and all sorts of beans, whether it is white bean, black bean, kidney bean, pinto beans, whichever beans you can, try to have them in your daily diet. Remember, osteoporosis is preventable for most of the people. All what you need to do is start building healthy bones while you are young. Yes, this is the best time for us to improve our bone mineral density, bone health overall, so that the healthy bones can survive and help us live life fully in later ages. Healthy diet and lifestyle are important for both men and women. It is not only for women, even men suffers with osteoporosis. Now I would like to focus a little bit on exercises. Please don't ignore. Simple exercise, 30 to 45 minutes daily can help improve your bone mineral density. Start doing simple exercises at home. You don't need even gym. Do not give excuse that I don't have accessibility to gym. Start doing exercises like plank, push-ups. These are just examples. Squats and lunges. Squatting and lunging. These are excellent movement of our body, which is needed. With our comfortable lifestyle, people are forgetting to use these movements in day to day. But we need to reinforce. Try to do the simple exercises, walking, jogging, running, swimming. Casual exercises for the females is important. Leg raise, squat, lunges, these are excellent exercises. Try to do at least 35 to 45 minutes daily. This will improve, this will help your bone mineral density to be better. And as I keep saying, when we talk about lifestyle, is not about only what you eat or only exercise. It also includes improving your sleep level. Yes, when we are in sound sleep, our corticosteroid hormones goes low, and a better hormonal balance is developed. It helps reducing our stress levels. Good quality sound sleep helps reducing our stress. It improves our body's healing power. It also helps decreasing our reflux symptoms, acidity. It also helps improving overall stress level of your body. So thus we need to sleep well. And the last element towards good lifestyle is stress. Stress can deplete the production of prostaglandins, which protects our stomach from the effect of ill effects of acid. So we need to improve acidity, to improve our bone health. Why I'm emphasizing acidity? Out of 10 patients, 9 patients are seen to be suffering with some or other ailments of acidity. That's one of the reasons which triggered that, yes, I need to focus that, yes, how prolonged acidity also impacts your bone health. So try not to ignore that. Remember, you are never too young or old to improve your bone health. Try working towards it, eat healthy, learn to live healthy by adapting a healthy, physically active lifestyle, and try to reduce stress level by adapting to some breathing exercises, doing yoga, meditation, whichever form helps you. And try to catch up on your sleep, sleep well. Thank you so much. With this, I will stop sharing, and the floor is open for all the participants to put up their questions. Dr. Doshi, can you see the questionnaires? Please unmute. Please unmute, yeah.
Yes, so you can moderate the questions and I will
Yeah.
gladly answer them. Yeah.
There's a question for you, Dr. Doshi.
Yeah.
Has there been any study on the benefit of yoga to avoid osteoporosis, weakening of the joints? Someone has asked.
Right. So I'm not sure whether there are, but there may be. But I think definitely yoga has a significant impact in a positive way, because when you do a lot of stretching and certain position asanas, you are actually loading the bone, and this can increase the strength of the bone, and this would indirectly, involve a lot of muscle tone, muscle stresses on the bone, and this will definitely help to a certain extent in avoiding osteopenia. But I think more importantly, it's as we all know, yoga is a very holistic approach. It's not just about physical well-being; it's also involving the mind, right?
Right.
Emotions, but
And also, yoga helps improving your body's balance, which definitely helps reducing this falling down or getting fractured because of the falls can get reduced. So that definitely helps kind of, improving your bone health in long run. But yeah, research has not proven anything that bone mineral density can be restored with yoga or not. But definitely your bone health can be improved because you are regularly exercising. The next question is from Shanti. Will there be pain due to the implant for the lifetime of the person? What to do to avoid this pain? That goes to you.
right. So it depends where the implant is placed, right? If the implant is placed on a part of the bone which is very superficial, for example, if you have an implant just lying at the region of the elbow, and over here, as you can all feel your own elbows, there's hardly a lot of muscle. Just beneath the skin is the bone. So if, of course, there's a big metal plate lying there to fix the fracture, then this can give you a bit of problems, especially when you put your elbow on the table, for example. Then yes, sometimes there may be a need to remove the implant. But most of the other times when the implant is deep within the muscles, it should not give you a significant problem, and usually removal is not really indicated unless there are some other reasons for removal of the implant.
I think the next question was related to that only. In relation to the situation, do you recommend taking out the implant planted in the upper humerus?
So typically in my practice, I normally don't encourage removal unless there is a pressing need to do so. So I always advise people to uh, weigh the risk and benefits in whatever you do. So if you remove the implant, there must be a reason for it, because otherwise you are, going through another surgery, another procedure. There may be chance of wound adhesions, infection, many issues from just removing the implant. So if you're going to remove the implant, there must be a real justified need to do so. So I really don't advise or encourage removal unless there is a certain issue of concern.
That's correct. Anju has asked, a fracture in the elderly is fraught with more trouble than in the younger people. But what can we do to prevent fall? Preventive steps at a younger age, say around 50. I believe it is more about eating healthy, doing regular exercise, and also doing some weight bearing exercises also helps restoring your bone mineral density, which can actually improve your bone health so that you can avoid all these poor bone health related problems, right?
Yes, certainly. I think the key here is still prevention, because sometimes you may do everything to prevent an injury, but if someone knocks you, or you accidentally get into an injury, then of course you can't avoid it. But of course there are many things we as an individual can do to avoid. So if you find that you are having poor eyesight, for example, or you're hard of hearing, get that sorted out. If you think that your balance or your reflexes are not as good, then you have to be more mindful and careful. So a classic thing I every time tell my elderly patients is, if you decide to go to the market to buy some vegetables or groceries, don't go on a day where it is just rained heavily and everything is wet, because then you are unnecessarily exposing yourself to a higher chance of slipping and getting a fall. It may not even be your fault, and you go during times where it's very crowded, for example. Someone may be rushing to work and they may accidentally hit you from the back and you fall and you succumb to a fracture. So
Correct.
as we age, I think we have to be sensitive to our needs. At the same time, we must also be very critical of what we do, so that you choose your activities in a more intelligent and wise way, so that you prevent preventable problems. I'm not saying that you should not go to the market. Yes, you should still go, you should still be active, but it just to be a bit mindful of what more
Choose
can
the
I
right
do.
time. Choose the right time.
Exactly, exactly. So it's just little things here and there. So that's why I tell a lot of people that as we age, we need to adapt and modify. You can still live happily and have an active lifestyle, but there is some degree of adaptation and modification of a lifestyle that we have to do. And this becomes very, very important in trying to adopt a preventive way of doing things. Because if you can't adapt, you can't change, then uh, you may get into trouble.
So the next question is from Helen. What is the lifespan of elderly with fractured hip?
Okay, so the lifespan, if you look at literature, some studies have shown close to 20% of mortality at 1 year after a hip fracture. Of course, some studies have even shown a lower rate of 10%. Now, the next question is to ask, why is there a problem with the lifespan after a fracture? So most of the time, of course, if you don't treat the fracture for whatever reason, then the person will succumb to many other complications and mortality will be much higher. Okay, but if the person undergoes a surgery and you restore function, then again, it's important to ensure that it's done early so that you minimize the potential complications. It's usually the complications which lead on to determining the lifespan. All right, the hip fracture itself, the implant itself, is not going to cause a problem. So we've also seen many people with a hip fracture who are living more than 10 years, 15 years, not a problem.
Okay. So there is another question. Could you advise on good and useful over-the-counter supplements which can taken to improve bone health?
Okay, so this is a very interesting question, because I personally am not a person who encourages taking too many supplements or pills. There is an issue in the elderly called polypharmacy. which means that a person already has so many drugs because of diabetes, hypertension, and above that, they've got another string of supplements they're taking. So this itself can be an issue, right? So I think supplements, yes, you can take them if you're deficient. So if you're not deficient, then I don't really see the need of taking a supplement. It's going to become an economic burden. It's also going to cause unnecessary confusion and unnecessary.
They should try to maximize their nutrients from their daily diet. Their food
Exactly.
has to be well nourished.
Exactly.
Supplements are only needed if you are deficient in spite of your dietary changes.
Yes. But of course, it's important to look out for certain common issues. Like many of us may be anemic. So if you're low in iron, yes, in spite of taking good food, you may inherently have a problem of iron absorption, and therefore you may need some supplement. The same thing is vitamin D or calcium. So in such situations, yes, you can, take some supplements. But I don't think you should just take supplements for the sake of taking a supplement.
Right, right. These should be avoided as much as possible, only in situation specific where your body really needs it. Yes, we need to. Otherwise, we should avoid it. Okay, there is another question. Does intake of dairy increases or decreases incidence? Now, if somebody is vegetarian, I would definitely suggest them to have dairy as a component to add on calcium in your diet. Not only calcium, calcium plus protein source. Dairy in the form of yogurt or curd is excellent for your probiotic health. It improves your gut health also. So when you are asking the chances increases, incidence or decreases, Aruna, I think you want to ask something more in detail. This definitely helps improving your calcium intake, which improves your bone health overall.
Yes, I asked this question because certain studies show that countries, especially in Europe, where they have increased intake of dairy, the incidence of bone fractures is higher in elderly.
So now when these are the specific studies where the proportion is very high. So usually it is in a moderation. Do not overdo it. Some people like who have a tendency to have fractures more, although their calcium is high, their parathyroid hormone could be a reason behind it. We need to check all the reasons. It's not just a dairy intake which has increased. Along with dairy, there were other health conditions which one need to take care of.
Okay.
When you ask for a normal person, normal individual, if that person is vegetarian, I would personally suggest, yes, please go ahead with dairy. And I would preferably say if the dairy is hormone free would be the first preference. But if not possible, at least stick to yogurt. Curd will help you. Don't say no to curd just with the fear of oxytocin. At least yogurt you should continue with. Otherwise, it is very difficult to balance the calcium naturally, and especially for females and postmenopausal females, having calcium-rich diet, and on top, if the female is vegetarian, becomes very, very difficult to have your protein balance as well. And talking about the bone health, that is the time I also suggest maximize your diet with calcium rich food, and on top try to have calcium supplement so that your calcium absorption should be uplifted. So Dr. Doshi, what do you say? You want to say something about this dairy increase or decrease incidence?
No, I think you've covered it well.
Thank you. There is another question. Okay, somebody has asked, would you recommend similar strategy to be applied to persons with long-term immunosuppressant that induced early osteopenia or osteoporosis? Should I repeat? So the person is asking if any similar strategy to be applied to persons with long-term immunosuppressant that induce early osteopenia or osteoporosis.
Yeah, so the strategy, I think it's again, if you know that you are at a higher risk of osteoporosis, then of course fall prevention has to be started much earlier, because meaning that you may have weaker bones at a younger age because you're constantly on an immunosuppressive drug.
Okay. So there's another question from Gopi. How does legumes and beans trigger acidity? See, legumes and beans are a little hard to digest. So they generally are found too hard to digest, and thus they increase gassiness and flatulence in your body. So that also increases acidity because they are not easily digested in your gut. So that's the reason those who are already suffering with acidity, they should better avoid this. And especially they should avoid consumption of these legumes or beans during night. Yes, digestion is little difficult, and at night your food should be easy and simple, which is easy and simple for your gut. It's easy for your body to digest well. So try to avoid this legumes and beans. I have suggested this more for the people who are already suffering with acidity, because this will increase your acidity level because it is very, very hard to digest. Okay, then there is a next question from Nara. Will weight exercise be good for those above 65 to strengthen the bones and muscles? Yes,
Weight,
Dr. Doshi?
weight exercises. Huh?
Yeah,
Yeah,
weight.
so I think a little bit of weight is fine, but not too much of weight, right? Because you must also understand that if you lift something very heavy, you are putting a lot of stress on your tendons and ligaments. So that is why sometimes we find that there are some individuals who decide to go to the gym, they carry something heavy, and then they come with shoulder pain. And the next thing you know, they've got a tear in their rotator cuff and they've injured their tendons.
They need to
So
start with small weights, right?
yeah, so a little bit of weights, it should not be overstraining your tendons, but the intention here is not, you're not trying to build muscles, you're not trying to build big biceps. You're just trying to tone the muscles and maintain the strength of the muscle. And by doing these weights, it's actually having a very positive effect on your bones to ensure that the bones are always put on some kind of stress so that it encourages new bone to form and makes your bone strong. But it should not be with the idea of carrying heavy weights so that you burn calories and build muscles, because that is when then injury tends to happen, whether it's your shoulder, your knee, your ankle. So we'll have to be a little careful when it comes to carrying weights.
Okay. There is another question. Do we need to check bone densometry regularly in case one know they have started with osteoporosis and had a fall already and a fracture? If yes, how frequently? Or is there any other way to check whether eating well and exercising is having any effect?
Okay, so I will answer the first part,
Yes, yes.
All right. So basically, if you have a fall, especially in someone who's elderly, it's prudent to screen for osteoporosis. And if you are having osteoporosis with a fragility fracture, that becomes a real indication to be treated. So you need treatment. All right. And now, in terms of follow up, once you're on a particular treatment for osteoporosis, I think repeating the bone mineral density after 2 years is a valid time frame, and to review again whether your bone is getting stronger or not. And for the diet part, maybe Mino, you want to address?
Yes, definitely eating a healthy diet, a bone healthy diet, which I have already shared. Ensure, again, I'm repeating, your diet should be rich in calcium, magnesium, vitamin D, vitamin K, and phosphorus. These are something which need to be taken care of. The rich sources I also have suggested: dairy and all sorts of dairy products, soya product, all sorts of beans and legumes, lot of leafy vegetables, mushrooms, sesame seeds. This can help you improve your bone health. There is another related question which says having thyroid as well. So if you are suffering with thyroid, avoid soya milk or soya bean, but you can still continue with rest of the food which I have suggested. That is totally fine with you. And the second part of this question was, and exercising is having any effect. So at young age, as we are promoting already, that yes, exercise helps restoring your bone mineral density. So eat healthy, which is bone healthy diet, so that your bone is getting enough of all the minerals which are needed for its restoration, and do regular exercise, which will help avoiding and reducing bone mineral density loss. So which will help strengthening your bone health. Definitely will help you even after the fall. You said after the repair is already done, after the normal life is started, gradually build up on doing exercise so that your bone strength can be restored. Next question is, would you recommend routine supplementation with calcium and vitamin D in osteoporosis and osteopenia without need to checking its level?
Okay, so I think it's very important to check your levels first, because you don't want to take too much of calcium and then end up with other issues of having high amount of calcium, right? Like calcium stones and having other issues. So I think it's always important to do blood tests, and this can be easily done uh, just to screen if your calcium and vitamin D are within normal limits. And if it is deficient or insufficient, then you should take more to normalize it.
There's another question, is obese person more prone to fractures? You explain.
Maybe you want to discuss about obesity and
Yes, when we talk about obesity, see, obese person, why the obesity is there? First of all, it's your poor or ill habit of eating. And gradually your body starts demanding for your food more, and your inactive lifestyle, which could be a contributing factor to a greater extent. Now, when we talk about the fractures, it's not about being only obese or being on a right weight zone. Of course, being obese adds on more pressure. If suppose you fall, your fracture chance will be definitely more higher than a person with a normal weight zone. So yes, in short, to answer your question, Mr. Umang, yes, obese person may get more chances of severity of the fractures as compared to a normal weight bearing person. But more prone to fractures depends on how good or bad is your bone health. So chances are, yes, high for a obese person in comparison to a normal weight bearing person. So try to eat healthy, try to do regular exercise. Yes, that will help improve your bone health. You are a young man. Don't just look after for all these treatments. Try to improve your lifestyle so that your bone health can also improve, and so as your overall lifespan. Malvika has asked, is there any connection between bloating and sciatica like conditions? Yes, Dr. Doshi.
bloating.
Bloating and sciatica.
Sciatica. So sciatica basically is something to do with the spine, right? Now the thing is, it simply means that if there is a disc which is prolapsed and if it's impinging your nerves, that is when a particular person may experience sciatica, which just means that the nerve root is being passed on by a disc. So then the next question you have to ask yourself, what are the factors which can make a disc bulge and cause a problem? So of course, people who lift a lot of heavy weight, they may have a disc prolapse. People are always constipated, right? And when you put a lot of strain, for bowel movements, you can get a disc prolapse. Someone who's having a chronic cough, someone who's obese. So these are some factors which can lead on to an acute disc prolapse. Of course, even in smoking, people who smoke a lot, there is a risk of disc degeneration, and the disc can degenerate, and it can also cause issues of disc herniation and problems with sciatica. But bloating itself, I think there is no direct correlation. It's more of why you're having the bloating, and are you having a lot of cough? Are you having a lot of bowel issues, which puts a lot of strain? So these are the risk factors which can affect the disc. And if a disc bulges out, then you can get an issue of sciatica.
And sometimes it is also seen like those who are suffering with sciatica. And then on top, if the bloating is there, overall discomfort level will go high. So, but then there is no direct relationship. But as you have already explained, bloating can add on to your pain.
Yes.
So there's a next question from Mr. Bhushan. It is for Ms. Mino. Okay. Is it true that dairy products such as yogurt, milk, cheese are not recommended to be consumed in the evening or after sundown or sunset? Or is this just a myth? Okay. According to Ayurveda, they say try not to have dairy, yogurt, milk, or cheese after sunset. But I truly believe this has to be person to person. I have seen people having dairy post sunset and they are doing absolutely fine. And I have seen some are not able to consume properly because their body shows some rejection. So try observing your body. If you feel that you are absolutely fine after having dairy in any form post sunset, please continue. And especially if you are vegetarian, please do not ignore it because this is really needed. So as to short, your question is, in very short, try observe your body, how your body responds towards dairy post sunset. And based on that, you decide continue or not. Ava has asked, is walking outdoor is better compared to treadmill if you have osteoporosis? Dr. Doshi.
Yeah, so you can walk outdoor in the night. That's not going to make a change. So walking outdoor, definitely if you're walking during the times of the morning sun, yes, definitely it's better because you get some sunlight exposure and this can help you in your vitamin D.
Okay. So walking outdoor, added on benefit during sunlight is your body can absorb some bit of sunlight, which definitely will help you to gain more vitamin D. Okay, there are some questions on Facebook too, as we were on Facebook Live. So let me just read out. Saida has asked, does osteopenia lead to osteoporosis? How can it be avoided?
Right. So, yes, it can lead on to osteoporosis if you,
I'll just mute everybody. Dr. Doshi, you can unmute.
right.
Yeah.
So osteopenia can lead on to osteoporosis. So that's why it's important to find out the reasons of your osteopenia. Right, it may be due to lack of exercises. You may be having underlying low vitamin D, calcium. So you need to sort these issues out and make sure that you repeat your bone density test to make sure your bone strength is improved. But if you don't address these issues, then it may be on the journey down to a osteoporotic range. And that's what you want to avoid basically.
So the next question is from Sunita. Can osteopenia be reversed?
Yes, it definitely can be reversed. So it just simply means your bone is a little weaker, osteopenic. And if you comply with all the factors which we've just discussed, it definitely can increase the bone strength and you can normalize it.
And another question is, can the damage done to your joints becoming D-shaped due to rheumatoid arthritis reversible?
Unfortunately not. Whenever you have rheumatoid arthritis, it is due to an autoimmune condition. It does have uh, long-term effects on a particular joint. And typically it will go into what we call secondary degenerative changes. And these changes are not reversible. But what you could do is to adhere to certain measures to retard the rate of deterioration. So that is in our capacity. But the underlying problem, which is immune related, you can only reduce the effect by taking the medications which your rheumatologist has given you to reduce the flare. But whatever effect it has on the joints, that may be permanent and it can lead on to further deterioration.
Okay, one more question from Mr. Prabhakar. How to prevent knee joint deterioration?
Right. So I think some of you may have heard us speak before on the topic of knee.
Yeah.
But if you want more information, you can always go on to my YouTube channel or my blog page, and you can see some articles which are pasted there on knee degeneration. But typically, I think prevention is from multiple aspects. Number one is to avoid an injury. And this avoidance of injury should start from a very young age. So sometimes you have sportsmen who have injured their knee multiple times with some ligamentous injury or fracture. This becomes a precursor to the start of osteoarthritis. Now, other factors will, of course, include obesity. If you have a lot of weight, which is being bared by the knees in your day to day activities, then, of course, wear and tear is more likely, and you will have higher chance of osteoarthritis developing. And of course, then thirdly is our lifestyle, the way we do things. If you always are, climbing up and down stairs, squatting, jumping, then this can compound to many other issues, especially like meniscal injuries, wear and tear of the cartilage. And this all then will present itself with pain and stiffness as one ages. And typically, when you do an X-ray, you will see evidence of osteoarthritis. So I think, yes, it is preventable to a certain extent, but definitely some degree of wear and tear will happen. So I think the ball is in our court to determine what we do and how we do things.
So the next question is from Nara. Dr. Doshi and Ms. Minut. Okay, thank you for sharing. What is the difference between arthritis and rheumatism?
Right. So rheumatism basically it's with regards to joint related pain and inflammation. When you talk about arthritis, the suffix itis just simply means some amount of inflammation. And this arthritis can be either due to degenerative arthritis or it could be due to inflammatory arthritis from rheumatoid or psoriatic arthritis, many other reasons. You can even have septic arthritis due to infection. So these are two different terminologies, but I think the key here is to find out what is the underlying pathology. And for that, if whenever you have a joint ache or a muscle ache, it's important to get an early diagnosis because with your detailed history and examination, the doctor will probably be able to rule out what are the most likely possible causes. And sometimes you may need to do a blood test to determine if it's something related to the blood, such as autoimmune problems. Often you will be advised to get an X-ray done and sometimes even an MRI. So based on this investigations, then you'll be able to come to a more definitive diagnosis of the problem and manage it accordingly.
Okay. So there is another question from Mr. Mukund. My wife had sacral fracture a few months back without a fall or without lifting anything. How to prevent such things repeating in case missed at your end?
Right. So sometimes we can get what we call insufficiency fractures because sacrum basically it's a bone right at the lower end of our lower back. And when you sit, of course, there's a lot of pressure on that particular bone. So if you have underlying osteopenia, osteoporosis, and you're sitting for too long, or you may have just sat forcefully for a particular reason, this can sometimes lead on to a fracture. There must be a reason for the fracture. It's probably some amount of trivial force or injury with some underlying issue of the bone itself. So I'm not sure how old is your wife, whether she's got osteoporosis, osteopenia, whether she's got any other underlying medical problems. But all of this need to be investigated. And definitely if there is a fracture, it's not something usual. There must be some underlying pathology of concern. That's why she succumbed to a fracture without even a significant injury.
Yeah, most of the time these things are not been diagnosed properly. People are not aware what the condition is already underlying, and sudden fracture can give them a shock. So ideally, it is a good idea to get annual health tests done. You know your calcium status, you know your vitamin D status, you understand your bone health, how it is going. So as you don't miss out on osteopenia or osteoporosis condition, which may be initial stage at the moment, and if ignored, can further deteriorate later on. So try to avoid these conditions. Try to get your tests done regularly, at least once a year for sure. There is another question for you, Dr. Doshi. Can foam rolling be helpful to avoid joint degeneration and geriatric fractures?
Okay. No, I think it's not going to be a direct correlation of reducing the incidence, but of course, it is helping you in doing some kind of an exercise, which will definitely help you loosen your muscles and strengthen your bone. But there is no direct correlation in reducing the incidence of a fracture.
Can.
Right?
It definitely helps improving the flexibility. Your muscles will get released. So aches and pains will be reduced, but it will not impact on your fractures or the bones. Yeah. So there's another question. Okay, Deepa has asked on Facebook, is calcium needed at age 40 or above? So Deepa, for females at age 40 or 40 plus is the time when you really need to emphasize on your bone health. Why? Because post 40, we know the female's body starts to prepare for menopause, wherein our bone mineral density can lose very drastically. So yes, you need to emphasize on your food to maximize calcium intake from your diet. And then on top, if needed, yes, you can take calcium supplement, which could be around 500 to 600 mg per day, not more. But try to maximize from your diet. That is the best way. Okay, I think all the questions has been covered. Thank you so much, Dr. Doshi. And for the new people, those who don't know, those who are first time joining, attending Dr. Doshi's talk, yes, he is Singapore based. He is easily available on Facebook. He is there. He's there on LinkedIn. His address is already there. If anybody wants more information, I can share his details later on. Please ping me, or you can directly connect on Facebook to Dr. Hitendra K. Doshi. Okay, there is a last question, Dr. Doshi, we should be wrapping up with. I have taken Forteo injection for 26 months. Any chance of getting my femur bone? Any problem?
Yeah, so I think you need to discuss this with your attending physician who's been giving you this medication, because every medicine you take, there is a risk and benefit. All right. Now, typically, you should be re-evaluated for the need of taking this medication based on your bone density tests. And sometimes you can get some amount of insufficiency fractures if you're taking certain medication. So you have to be conscious of these issues, and always have a close follow-up with your attending doctor. And if there are any symptoms for any other reason, you should always relate this back to your attending doctor, because they may want to change the medication of choice in treating the underlying issue.
Okay, Dr. Doshi, last question I would like to ask. It has been asked on Facebook. How about if one is dependent on immunosuppressants in case of autoimmune disorders like lupus and rheumatoid arthritis? For
Right.
them. Yeah. She has asked a part question here. Just a second. Just running away. So many questions here. So for them, for these conditions, she wants to know whether any changes in the or deterioration in the bones can be reversed, or osteopenia with this existing rheumatoid condition and lupus condition, can that be reversible?
I think she's asking whether these medications which are required for a condition, it'll lead on to osteoporosis. So how do you tackle that?
Possible, because
Yeah.
she's not clear here.
Yeah. So I think one thing we should all be very clear about is, in solving any issue, it has to be multidimensional. So there is no one fix for every problem, right? Now, if you have significant autoimmune problem, certainly you need the medications to regulate this autoimmune condition, because that is very, very important. You can't avoid these medicines and end up with other complications from the disease. But at the same time, when you take certain amount of medications, every medication has a side effect. So if you're taking a lot of steroids, steroids in itself has its potential side effects, and one of it is osteoporosis. So of course you can't avoid it, because when you compare these two conditions, you have to take these medications which are very critical to cure the underlying autoimmune problem you have. But because it has some side effects of osteoporosis, so we have to be mindful how to minimize the side effects. So ensure that you've got adequate calcium, vitamin D, do your regular exercises, right? And if you know that, yes, you have osteopenia, then you have to be more mindful of avoiding falls, because there is no one fix for every problem. And sometimes there is always a pro and con of anything you do, right? So I think it's being aware of the problem is most important, and how we as an individual, having understood the problem, we can mitigate or avoid potential issues uh, through adapting this preventive lifestyle in any problem, whether it's due to osteoporosis, or some of you have asked questions of knee arthritis. Some of you have questioned, that I have to take some amount of immunosuppression. So there is no clear answer to all of this, because some things you need to take them, right? But we have to be mindful of how we can manage the other potential complications.
So to be in short, basic things which is needed to maintain your normal condition of your health, which are very important, which is not going to be ignored, we need to have those medication. But on top, to minimize the associated condition, it is based on your condition specific. You need to see what is needed, and as per your condition it has to be advised. One general solution does not fit everyone's condition. So I will also like to take this question once. Vidya has asked on Facebook, as one gets older, how do you maintain bone health, especially with diet restrictions and not much of exercise? So Vidya, there is no magic wand which can actually reverse the condition if there is some diet restrictions. Yet I am sure there can be various other options of diet which can help you to improve your bone health. And saying zero or absolutely no exercise, I need to understand, why is it so? Is there any restriction in lifestyle? Is there any specific situation which is not allowing the person to exercise? Even yes, then also there are certain forms of exercise which can be done with that restricted conditions. I would suggest in that case you should visit an expert to discuss your health condition, so that they can suggest you, understanding all your situation, irrespective of whether it is diet or exercise. Both can be actually dealt nicely. I hope you got your answer, Vidya. Because general answers, these are certain things where one need to understand what are the dietary restriction which she is trying to say. Just writing dietary restriction will not be clear with there. So I would suggest discuss and speak to a professional who is a diet expert. You can approach any nutritionist or dietitian regarding your dietary restriction condition, which can help you, suggest you with a proper diet to improve your bone health. And also you can speak to some exercise specialists, some physiotherapist, or some PT trainers or Pilates expert or yoga trainers who can actually help you and guide you how to improve the exercise in the limited conditions. Okay, thank you, Dr. Doshi. With this, I would like to wrap up today's session. Thank you, all the listeners and viewers. Yes, Dr. Doshi.
Yeah, so I'd just like to make a last comment. I think, treatment without prevention is simply unsustainable.
Absolutely.
So at the end of the day, what we're trying to do here is we're trying to raise the consciousness of mankind on the importance of awareness. And the awareness has to be very, very importantly understood and correctly understood, so that you can actually adapt a preventive lifestyle. Because many injuries, trust me, are preventable. It's just that we take it too lightly, or we tend to ignore it until we come to a critical situation. But the point is, we all want to live in a very happy way. We want to live and age gracefully without any problems. So be mindful of certain things. As we age, there's going to be a lot of changes in our body, which is a very natural process. But at the same time, we also have to change in our ways be more adaptive so that we can prevent problems. All right. And to all of you out there, if you have any queries, feel free to ask me, or you can even approach me through my Facebook. And I've also got a website where I've got a blog page which shares a lot of information. You can just read through them. And of course, you can also type HK Doshi Orthopedic Center YouTube. There are some short informative video clips just for a better understanding so that you raise your consciousness of problems and avoid them. So with that, I thank all of you and I wish you all a very good health. Stay safe and be happy. Thank you.
Thank you, Dr. Doshi. Thank you all the viewers today. Keep following us for our Health Talk series. We will be coming up soon with another topic of your interest. Keep posting the topic which you would like to hear and want to know more about. As Dr. Doshi has already said, prevention is better than cure. So few tips before we leave today's session is kindly remember four elements of your lifestyle. It is good food, regular exercise. Do not say no to exercise. It is very, very crucial. And try to get a sound sleep and try to reduce your stress level. Yes, stress and anxiety helps, increases your corticosteroid level, which also deteriorates your bone. So remember, stay healthy, stay fit. With this, thank you so much. Bye-bye. Take care.
Thank you. Bye-bye.
Bye.